A very good morning to all of you. Today's our new topic, bleeding due to vitamin deficiency. If you like our videos, then do share it, do subscribe to our channel, and obviously give it a big thumbs up, and that gives us more motivation to make such videos. So today's topic is vitamin deficiency leading to bleeding manifestations. So let us start with it. Now, whenever you say bleeding and that is due to vitamin deficiency, there are two vitamins that come to your mind. First is vitamin C and second is vitamin K. Now, as we know, what are the functions of these two vitamins in our body? For example, vitamin C is mainly involved in collagen synthesis, especially in the capillary walls. So the function of vitamin C is collagen synthesis in capillary walls. Now, if we talk about vitamin K, then it is involved in gamma carboxylation of the coagulation factors in liver. And what are the factors? Factor 2, 7, 9 and 10. So these are the factors which are activated with help of vitamin K, or for which activation vitamin K is required. So these are the two main functions of each vitamin. Now, what if these two vitamins or any one of them is deficient? For example, in case of vitamin C deficiency, obviously the fragility of capillary wall is increased because there is no collagen, or less collagen is formed. And in case of that, there will be hemorrhages, and these hemorrhages could be spontaneous, and they are especially seen around lower limbs, around hair follicles. And the third common site is nail beds. So you will see hemorrhages in lower limb in form of hematoma, especially around joints. While in case of vitamin K, if it is deficient, obviously there is no coagulation factors which are active, there will be bleeding. So lack of coagulation factors, activated coagulation factors, they lead to bleeding, which could be anywhere. Now, how with help of laboratory test we can differentiate these two vitamin deficiencies? For example, we know that there are 4 or 5 tests in case of a bleeding disorder that has to be done. So first is bleeding time, and as we know, bleeding time increases when there is either platelet disorder or vessel wall disorder. So it will increase in case of vitamin C, but it remains normal in case of vitamin K. But the clotting time will remain normal in case of vitamin C deficiency because coagulation factors are not involved, while it increases in vitamin K. Same way, prothrombin time, PTT and TT, they will increase in case of vitamin K deficiency, while they remain normal in case of vitamin C. Thank you.